Hello, I'm Jane Williams and welcome to Webinar 7, Content of Patient Health Records. Country SAPHN acknowledges the traditional custodians of the lands we live and work on and pay respects to the elders, past, present and emerging. We recognise and respect the unique cultural and spiritual relationships to the land, waters and seas, which continue to be important to Aboriginal and Torres Strait Islander people today. The objectives will cover national privacy principles, patient health records, access to care, and comprehensive care. National privacy principles. Your practice must have a clearly expressed and up-to-date policy about the management of personal health information, and it must contain the kind of personal information the practice collects and holds, how the practice collects and holds personal information, the purpose for which the practice collects, holds, uses and discloses personal information, how an individual may access personal information about the individual that is held by the practice, and how to seek the correction of such information, how an individual may complain about a breach of the APP and how the practice will deal with such a complaint. Disclosure to overseas recipients. Whether the practice has a policy to disclose personal information to overseas recipients. If the practice is likely to disclose personal information to overseas recipients, the countries in which such recipients are likely to be located, if it is practicable to specify those countries in the policy. Availability of privacy policy. You must take steps such that are reasonable in the circumstances to make your Australian privacy policy available, free of charge and in such form as is appropriate. This is fairly straightforward. Your practice must have an up-to-date policy and you must normally make it free of charge to those who ask for it. The format is not defined. It may be electronic and or hard copy, but in practical terms, it would be good to have it on your website as well as hard copies available for those who ask. Patient health records. Patient health records, hard copy or electronic, are a record of the patient's attendance at the surgery. They must contain the name and address of the patient, date of birth, next of kin, emergency contact, and allergies for a start. Height and weight. Family history is important. Records will contain documentation of previous medical history and lists of medication, lifestyle, smoking and alcohol make up this comprehensive list. Access to care. Access to health care is a necessity within the public domain and it varies depending on location and the services available. Policy for accessing care. Every practice must have their policy for patients accessing care clearly available. This is particularly necessary for patients needing to access care outside normal consulting hours. After-hours locum. In the city and larger towns, there is often an after-hours locum service available, so contact details must be available for patients. After-hours service by local GP. Some practices do their own after-hours house calls, and in country areas it is not unusual for patients to be directed to the local hospital, where the duty nurse will triage the care required, then call the on-duty doctor. In small town, it is usually the local GP who is also on call for hospital admissions. Comprehensive care. GPs are personal doctors, primarily responsible for the provision of comprehensive and continuity medical care to patients, irrespective of age, sex, ethnicity or illness. General practice also provides comprehensive care services including health promotion, disease prevention, curative services and rehabilitation. Thank you for taking the time to join this webinar today. Country SAPHN gratefully acknowledges the financial and other support from the Australian Government Department of Health. For resources, you can email us at support@countrysapHN.com.au. Resources can also be found online at agpal.com.au and the 5th edition standards from the RACGP.